We've all experienced the discomfort of a stuffy nose. Sometimes this stuffiness is just a cold, but other times it can signal a more bothersome issue, a sinus infection. Sinus infections, also known as sinusitis, can be a real pain, literally. Imagine your sinuses as small, air-filled pockets located within your skull, behind your cheekbones and forehead. These pockets play a crucial role in your respiratory system, helping to humidify and filter the air you breathe. However, these essential cavities can become inflamed and swollen, leading to a sinus infection. To truly understand sinus infections, it's important to first grasp the role of our sinuses. Picture these sinuses as small air-filled chambers strategically positioned within the bones of your face. This intricate network of sinuses, connected by narrow channels, ensures the smooth flow of air and mucus, contributing to your overall respiratory health. However, these normally efficient guardians can become compromised, leading to the troublesome condition known as sinusitis. Sinusitis occurs when the delicate lining of your sinuses becomes inflamed and swollen. This inflammation can be triggered by a variety of factors, with viruses being the most common culprit. Sinusitis, like many other medical conditions, presents itself in various forms, each with its own set of characteristics and challenges. Understanding these forms is essential for effective treatment and management. Acute sinusitis is a short-term inflammation of the sinuses, typically lasting for a few days to a couple of weeks. It often causes symptoms like nasal congestion, facial pain, and a runny nose. This type of sinusitis is incredibly common, often developing as a complication of a viral upper respiratory infection, such as the common cold. Most people experience acute sinusitis at least once in their lifetime. Chronic sinusitis, on the other hand, is a more persistent form of the condition, characterized by prolonged inflammation, lasting for 12 weeks or longer, even with treatment. This can significantly impact a person's quality of life. The causes of chronic sinusitis are often multifactorial, involving a complex interplay of factors, including persistent allergies, structural abnormalities within the nasal passages, and recurrent acute infections. These factors can make treatment more challenging. Differentiating between acute and chronic sinusitis is crucial for tailoring treatment plans to address the underlying causes and alleviate symptoms. Accurate diagnosis is the first step towards effective management. While acute sinusitis often resolves with conservative measures such as rest, hydration, and over-the-counter medications, chronic sinusitis may require a more comprehensive approach, including prescription medications, allergy management, and in some cases, surgical intervention. Understanding these distinctions empowers individuals to seek appropriate medical care and effectively manage their sinus health. With the right approach, both acute and chronic sinusitis can be managed to improve overall well-being. Recognizing the signs. Is it a cold or a sinus infection? Sinusitis, with its array of symptoms, can often mimic other common ailments, such as the common cold or allergies. This can make it challenging to identify the root cause of your discomfort. One of the hallmark symptoms of sinusitis is facial pain or pressure, often localized around the forehead, cheekbones, and bridge of the nose. This pain can be quite intense and persistent. This pressure, often described as a dull ache or a feeling of fullness, can worsen when you bend over or lean forward. Activities like tying your shoes or picking up objects can become particularly uncomfortable. This distinct facial pain is a key indicator that your sinuses might be the source of your woes, setting it apart from a simple cold. Recognizing this symptom early can help in seeking appropriate treatment. In addition to facial pressure, sinusitis often announces its presence with a persistent nasal congestion or stuffiness. This congestion can make breathing through your nose difficult. This congestion, unlike a typical runny nose, often produces thick, discolored mucus that can be yellow or greenish. This is a telltale sign that an infection might be present. Beyond facial pressure and congestion, sinusitis can manifest with a range of other symptoms, including headaches, a persistent cough, fatigue, and even a reduced sense of smell or taste. These additional symptoms can significantly impact your daily life. Early detection and treatment are key to preventing complications and ensuring a swift recovery. Consulting with a healthcare professional at the first sign of these symptoms can make a big difference in your treatment outcome. Seeking help. when a doctor's visit is necessary. While many cases of sinusitis resolve independently with over-the-counter medications and home remedies, certain situations warrant a visit to a healthcare professional. It's important to recognize when self-care is no longer sufficient and professional medical advice is needed. If your symptoms persist beyond 10 days without improvement, it's time to schedule an appointment with your doctor. Persistent symptoms can be a sign that your body needs additional help to fight off the infection. This persistent discomfort could indicate a bacterial infection or other underlying factors that require medical intervention. Ignoring these signs can lead to more serious health issues. Similarly, if your symptoms are severe from the outset, including a high fever, intense facial pain, or changes in vision, seek immediate medical attention. These symptoms are not to be taken lightly. These severe symptoms could signal a more serious infection or complications that require prompt evaluation and treatment. Early intervention can prevent further complications. Moreover, if you experience recurrent sinus infections, meaning you have 4 or more episodes within a year, consulting an ear, nose and throat ENT specialist is advisable. Chronic issues often need specialized care. Addressing these underlying causes is essential for breaking the cycle of recurrent infections and improving your overall sinus health. A tailored treatment plan can make a significant difference in your quality of life. Treatment options, from home remedies to medical intervention. The treatment approach for sinusitis depends largely on the underlying cause and the severity of your symptoms. For acute sinusitis caused by viruses, simple self-care measures and over-the-counter medications often suffice to alleviate symptoms and promote healing. One of the most effective home remedies for sinusitis is nasal irrigation, which involves rinsing your nasal passages with a saline solution. This gentle rinsing helps to flush out excess mucus, allergens and irritants, reducing inflammation and promoting drainage. Nasal irrigation can be performed using a neat eye pot, bulb syringe or squeeze bottle. In addition to nasal irrigation, staying hydrated by drinking plenty of fluids is crucial for thinning the mucus and facilitating drainage. Warm compresses applied to the forehead and sinuses can also provide soothing relief from facial pressure and pain. Prevention is key keeping sinusitis at bay. While it's not always possible to prevent every sinus infection, adopting certain preventive measures can significantly reduce your risk and promote optimal sinus health. One of the most effective ways to prevent the spread of germs that can lead to sinus infections is practicing good hand hygiene. Washing your hands frequently with soap and water for at least 20 seconds, especially after using the restroom, before meals, and after being in public places, can significantly reduce your exposure to viruses and bacteria. Managing allergies is another crucial aspect of sinusitis prevention. If you suffer from allergies, identify your triggers and take steps to minimize exposure. Boosting your immune system through a healthy lifestyle is essential for warding off infections, including sinusitis. Eating a balanced diet rich in fruits, vegetables, and whole grains provides your body with the nutrients it needs to function optimally.